Well, we're joined now by Senator Ifeanyi Okowa, who is the chairman of the Senate Committee on Health, to take a look at continuing our focus on the National Health Bill, actually. Morning, thank you for coming on today.
Thank you so much.
Well, last week we had Dr. Njamaze, who spoke extensively about this bill, what they had done, how he had appeared before the committee, participated in all of this, but he point blank just said the bill that was passed by the Senate is not in the interest of Nigerians. He talked about, which I'm sure you heard some of them, sale of organs of Nigerians, how the bill does not allow Nigerians have a right to say no to organ trading. I say, well, you heard some of those. Well, is that the case really?
I think he has a complete misunderstanding of the bill. I'm surprised because he was at the public hearing, and I believe that Dr. Njamaze actually put his ears on the ground at the public hearing, which was attended by all cross-sectional people from Nigeria. I think in the history of the Senate, that was the public hearing that had the highest attendance of persons. Issues were discussed because there was a particular clause which was provided in the old bill that was contentious. So it was actually discussed by all manner of persons, including those in the research industry, including those from the faith-based groups, the Catholic Bishops Association, and many other persons. Traditional institutions were there. And we did agree at the end that we were prohibiting the sales of organs, we were prohibiting the sales of human zygotes and embryos. So I'm really surprised that he still came in to speak about these things as if the bill allowed for the sales. It is very clear, and he quoted the wrong clauses. I even have the hard copy. I'm sure they sold that to you. It's stated clearly in section 50 of the bill, where I can read it for you just for us to understand. Because I presume that the bill he was actually talking about that day was not the bill as presented to the plenary in Senate, not to even talk about what the Senate did pass. But what the Senate did pass was what was presented after the public hearing, after the cross-sectional views. And it says in section 50, a person shall not manipulate any genetic material, including genetic materials of human garments, zygotes, and embryos, or engage in any activity, including nuclear transfer or embryonic splitting, for the purpose of cloning of human beings. A person shall not import or export human zygotes and embryos. Because the situation before now was that there was no law. This is the first basic law that actually provides a framework for the regulation, development, and management of the healthcare industry. So the situation before now, until this bill is signed into law, is that anybody can do anything. That is the current situation because there's nothing prohibiting them from doing so. But this bill now goes ahead to prohibit that because we don't think that it is right to do that, at least at the moment. It's not right. But now, if any Nigerian wants to import or export zygotes, there is no law that stops him. So anybody can do it. It's a free trade at the moment. But the bill, as passed by the Senate, on the due recommendation of the head committee to the Senate, seeks to prohibit the sales and importation of human zygotes and embryos.
What about the aspect of the bill that will make it somewhat difficult for Nigerians to gain access to health infrastructure? He talked about, in particular, he talked about a certain portion of the bill that talked about the size of the hospital, the size of corridors and all of that.
No,
that's talking about standards.
Yes.
He said this bill insists that there has to be a certain length or size to the corridor that it must be, otherwise you cannot operate.
I hope you referred you to the particular section of the bill because it's very obvious that in any country in which you decide that there will be no standards at all, then you're definitely heading for the rocks. There must be standards in everything that we do. Otherwise, you have quacks everywhere. But this bill does not limit anybody. It realizes that there are different levels of the healthcare industry. There's a primary healthcare industry for basic services. There's the secondary healthcare industry and the tertiary, which is at the topmost, where you receive specialist treatment. So it is important that you classify health technologies and health establishments in such a way that you know exactly how to manage it. Because when you classify them, then you have specific recommendations on each of these classified entities. And in the process of monitoring, in the process of setting standards, you know the standards to which each of them, the standards that they need to attain for them to be operational. It is done all over the world. So I find it difficult to believe that a doctor like him could speak that way. It's really funny. I think if you get back to the issue of, it's in clause 12, I think we sent the bill to you. It's very specific on classification of health establishments and technologies. It's only right that we must do so. We can't just allow a free practice and whatever you see, whatever junk you see anywhere, you allow it to be. It shouldn't be so. There must be some level of regulation. And that says the minister in council, which means involving the commissioners, all the states are involved, the National Council on Health, shall by regulation classify all health establishments and technologies into such categories as may be appropriate. I don't see anything faulty in that. Because the only other thing is that allow everybody to have a free practice. I may just be a general practitioner, but I decide to do things that I ought not to do. It is wrong. Then you kill Nigerians. At the moment, I'm aware that there are in some places where transplantation is done, people do all kinds of things because they are not regulated by law. But the normal norms does not allow it. But by law, they are not yet regulated. So they go on to do all kinds of things. We've had instances where people have had to do kidney transplant and people died when they don't have the knowledge, and then the establishments are not actually meant to undertake such procedure. And we've had it in Nigeria. Yeah, a lot of these cases are there.
Okay, part of what he was also alluding to, I think in relation to this part 2, which talks about the health establishments and technologies, which you just talked about in section 12. He was saying that the kind of standard that they were talking about was international standard. And if you gave specifics in terms of the size of the building and all of those, that if that were the case, you wouldn't have Nigerian or indigenous hospitals meet up with that international standards. That what you will have is foreign hospitals domiciled here, which will then facilitate or aid, as he put it, that organ transplant. He says that's intentional.
I don't think. It's reading the law upside down. The law is specific, basic, and it is there for everybody to see. If you read down that place, you go down, it will classify the role and function within national health, the size and location of the communities they serve, the nature and level of health services that they are able to provide, their geographical location and demographic reach, the need to structure the delivery of health services in accordance with national norms. So there's nothing that actually goes in the direction that he has said. But this thing, you need to be able to actually classify so that everybody knows the limits to which you can go. If you are a primary, normally it's by way of application. If you want to render primary healthcare services, then you render primary healthcare services. If you're going to render secondary healthcare services, of course, you have to look into the level of staffing, you have to look into the level of equipment that is available. And then if you're going to render tertiary healthcare services, then you're also looking at the level of course, you need consultants, you need specialists in various fields if you're going to render tertiary healthcare services, and the level of equipment has to be different from that of a secondary or primary healthcare. So these are issues, and I think it is right. But he cannot say that you want to bring in international standards, that is the intent. You have to have appropriate standards, and that's what this bill says. By regulation, and this regulation also takes note of the fact that we have not gotten to that level of advancement where we're going to make everything come into the levels that you probably may be seeing in America at the moment. But there's nothing wrong going in that direction, but we have to improve gradually. So if you go to the issue of the state regulation, there's also a specification. If you go to the clause 59 on the regulations, which says the minister, in consultation with the council, shall make regulations that are reasonable. I think if you go to that clause 59, you can easily filter that out. So I'm really surprised that he spoke the way and manner he spoke, because I don't think he was referring to this bill. The minister, in consultation with the National Council, may make regulations with regard to any other matter which is reasonably necessary. The word is classified there, and expedient to prescribe in the implementation of this bill. So at least there's a control process. And in the making of any regulations, when you probably go through with the National Council, usually there's a public debate on it in which people make their inputs. And I don't think that those who are practicing, those who are in public service, they are not stupid. But there has to be a control process in anything we do in this country.